Uganda lies in the tropical region of the world. Epidemiologists and researchers have found the tropics to have many and similar bacteria. These are the lead causes of many infections we suffer from. If you choose to ignore asking questions on the quality of doctors, nurses and paramedics you find in a health facility, you will be on the risk of contracting more illnesses, getting wrongly diagnosed, wrong treatment, and on the extreme, death may occur in quack health facilities. Amidst the growing number of bacteria, wrong diagnosis and treatment can result into antimicrobial resistance. The World Health Organization listed pneumonia, tuberculosis, blood poisoning and gonorrhea as infections that are becoming harder to treat as the antibiotics used to treat them are becoming less effective. But why is this happening?
The bugs themselves, they are becoming more complicated. If a bacteria wants to survive, obviously it's survival for the fittest, and so it will find ways and means of producing enzymes that go beyond the antibacterial activity.
Dr. Chitaka, a pediatric infectious diseases specialist at Mulago Hospital, says the number of children presenting these infections is on the rise.
We typically see infections like malaria, but also things like meningitis and pneumonia and neonatal septicemia. And I'm telling you that the biggest burden of bacterial septicemia is mostly in children.
Antibiotic resistance can affect anyone of any age, and it occurs naturally. But misuse of antibiotics in humans and animals is accelerating the process.
People have given antibiotics to chickens and to other livestock, and then the antibiotics are limited in the livestock. So they are causing further and further resistance.
Antibiotics are classified under Class B. This means they are only supposed to be sold on prescription, but this is the opposite here.
And I think the problem is with all of us. The clinicians who prescribe, the community that goes and picks antibiotics from pharmacies, and they don't complete the dose.
Other factors like weak laws have enabled medical professionals and drug shops sell antibiotics to people who do not need them or in less quantities. Poverty is also another huge factor in this.
Give me 2 capsules because that's what I can afford. And that's really dangerous because you're just simply massaging the bacteria and not killing it.
Medics have an important role to play in averting misuse of antibiotics.
Doctors shouldn't treat viruses with antibiotics. Doctors shouldn't be treating fungal infections, for instance, with antibiotics. They shouldn't be treating common colds with antibiotics. And it's important to follow the sensitivity pattern. If you don't, then the patient will not recover. The cost of developing one antibiotic costs about $3 billion US from the development in the lab and then using the antibiotic in animal models, and then by the time it reaches the population, which we call phase 4 trials, it is so expensive. I think in the last 50 years, only 1 or 2 new antibiotics have been formed because it's so expensive. And so if we run out of options, what is going to happen?
A strategic plan was reached by the World Health Organization during the World Health Assembly in 2015 to ensure prevention and treatment of infectious diseases with safe and effective medicines. Its objectives are to improve awareness and understanding of antimicrobial resistance, to strengthen surveillance and research, to reduce the incidence of infection, to optimize the use of antimicrobial medicines, and to ensure sustainable investment in countering antimicrobial resistance. Walter Mwesije, NTV.